So does it take 2.5 months to get a consistent erection, or 2.5 months until you even feel comfortable engaging in sexual intercourse?
No, I would say 2.5 months for consistency like I know I can be. It's embarrassing. It's frustrating. It's humiliating. It only happens when I really care about the woman. So that's the crazy thing. Like if I'm in Vegas and I had a one-night stand.
Good afternoon, everybody. Welcome back to Cafe Belmont. My name is James Belmont. Thank you for joining me. Today, I wanted to make a quick video talking about erectile dysfunction and how to get rid of it. This video is aimed for young adults from 18 to 25, but some of the things that I'm going to talk about in this video can apply to ages older than previously stated. The goal of this video is to give a solution or multiple solutions to the problem of erectile dysfunction and to reassure men that this is common amongst us. So we're going to start off nice and easy and define what erectile dysfunction is so we know what we're talking about and what we're trying to cure. So, erectile dysfunction is the inability to get or maintain an erection that is firm enough for sexual intercourse. This inability can be short-term or long-term. Now that we know the definition, we can start solving the problem. The first thing I'm going to tell you to do is what to avoid, which is taking prescribed medications such as Viagra or Blue Chew, which is a very popular stimulant to give you an erection. Using products like this does not solve the problem. It only behaves as a band-aid. It is a temporary solution to the issue at hand. Remember, you're still a young male. So the fact that this is happening to you is a signal from your body to make some changes. So don't be deceived into thinking that a product like Blue Chew or Viagra will be a cure. It is purely temporary. In the worst case, you might have a dependency on this drug, overriding your natural ability to produce an erection. Although I can see some use cases for this product where you are naturally able to get aroused. For example, if you were intimate with your partner for session 1 and you're trying to go another round, then Blue Chew could be a viable option. But my point is, it shouldn't be the first thing you do to get your Johnson going. That should be natural, especially around your age range. Moving on to the next solution, stop watching adult films. It has been well documented that watching adult film has a negative impact on your psyche, but it can also cause erectile dysfunction. An erection signals attraction to your partner. If you are accustomed to watching other people have relations with each other, then that becomes your new norm. So whenever you're trying to get intimate with your partner, it becomes difficult to get aroused because your mind is unable to view her as attractive enough to get your Johnson going. So try your best not to get accustomed to it. The best case scenario is always to remove it from your consumption library to regain the power that you lost. But this will not be easy. Just like anything in life, whatever you want is never easily obtained. Next, we're going to talk about things that promote blood circulation. This could be exercise, going for a walk, for example, eating specific types of food that allow blood circulation to be easier in your body.
If it's a blood flow issue, there are supplements, there are medications, there are things that we can treat as far as chronic disease processes like lowering your blood pressure, lowering your glucose, lowering your cholesterol, things like that.
It is not hard to understand why this may be beneficial. Essentially, blood flows into your Johnson when you are aroused and enlarges it. So, if blood is allowed to flow easier, you will have an easier time maintaining an erection. Next up, we have to talk about something that is probably the most important, which is your mental state. We're going to talk about the psychological effect that it has on your brain. Whenever you have a misfire, so to speak, a good percentage of the time, whenever you are trying to get an erection after a failed attempt, it is psychological every moment after that. So what this means is that the next time you're trying to have relations with your partner, all you're going to think about is, am I able to stand at attention? And stay like that for a while. By thinking in this way, you are subconsciously sabotaging yourself. If you remember from your previous encounters with your significant other, you didn't need to think about, am I or will I be at attention? But because now, after a failed attempt, you are in your head to the point where you can't even perform anymore because you are afraid, and anxiety kills erections. Another cause of ED could be overstimulation through everyday life. Imagine this. You have a limited supply of energy throughout the day. You are consistently being bombarded by things designed to make you addicted to them and make you feel good. If you are consistently interacting with those things on a day-to-day basis, you could feel numb to any type of emotion. You feel drained. You don't feel like doing any type of activity, even the most intimate ones. This could be scrolling on Instagram, watching your favorite YouTube video, or even doing something productive. My point being, all of those things siphon energy from you. So, whenever you see your significant other kissing on you, touching you, you don't get excited because you are physically drained from other things. The solution to this specific problem is actually something that we all neglected as children. It is called taking a nap. When the left side or the right side of your face feels like it's in pain because you've been in front of a screen all day, turn off every electrical device, lay on your bed with zero noise in your room, and just close your eyes for 30 to 40 minutes. I promise you, you will feel rejuvenated afterwards. I would highly recommend something like this before you are intimate with your partner. Trying a combination of all of the previous methods to resolve this problem, I'm sure you will be able to see some improvements. Remember, this is not something to be ashamed of. It is simply your body telling you that something is wrong, no different than when your body uses pain to signal to you that there's a problem that needs to be resolved. In conclusion, your body signals to you when something is wrong in many ways. This is simply one of them. There is nothing to be ashamed of. It's just another problem that life brings, and depending on how you respond to it, your life could be better or worse. This has been Cafe Belmont. My name is James Belmont. Thank you for joining me. Before I go, tell somebody in your life that you love them, and I will see you soon. Take care.